Healthcare is at the top of just about everyone's mind these days, and for good reason. We all want universally accessible quality healthcare that's affordable, regardless of who we are. But let's face it, healthcare, once a reliable community service where providers and their staffs make good livings, has become a mostly corporate-owned for-profit business where the high-level staff at hospitals, which are mostly corporate-owned, as well as top-level medical insurance industry executives, receive lucrative compensation and benefit packages. Just as you would hire an attorney to protect you in a business deal, more and more of us are discovering their need for a patient advocate who can help us safely navigate our ever-changing healthcare landscape. It only makes sense. When you're not well, you need someone who is and who understands the ins and outs of the business of healthcare today.
A patient advocate who is skilled in life care planning, as I am, is a professional who understands how the healthcare system works today. It means you've got to be empathetic for your patient, but you also need to have enough distance that you can understand how the business aspect of healthcare runs today, from a care point of view all the way to the financial arena, and also understand how all of that impacts the client legally, financially, and from an insurance perspective.
Lisa Berry Blackstock is a patient advocate and life care planner based in Los Angeles. She passionately believes each one of us is responsible for educating ourselves about the reality of what American healthcare has become and where it's headed. Lisa encourages her clients to strongly consider and act on the notion that just as each of us believes wills, trusts, and powers of attorney are essential, so is our healthcare strategy. We need to protect our healthcare in the same way, if not more so, as we protect our financial assets.
Well, having healthcare insurance today, unfortunately, does not mean that that guarantees you to any coverage, let alone quality coverage, in today's healthcare climate. There are different medical providers, such as hospitals and doctors and diagnostic labs, that will only accept particular policies for particular services. So unless a patient knows in advance what coverages will be available under their policies, it's a big question mark as to what you're actually entitled to.
Henry Wasserman is Lisa's oldest living client at 102, who also happens to be a close family friend since he was 97. In 2009, he suffered a moderate stroke. His local hospital discharge supervisor was intent on showing him the door before it was safe for him to leave. That meant more profits for the corporate-owned hospital. That's when Lisa stepped in on his behalf.
Henry, who we've taken in to live with us because he had no other options of a family to live with, he suffered a stroke at 99. There were a series of medical errors that occurred that actually set him back. So I took it upon myself to assume responsibility for him and got a rehab plan in place for him that I oversaw from our home, and he's just continued to recover and get stronger ever since.
Lisa came to my assistance, immediately told me the facts that were there, the treatment and such, and started to work that I didn't believe existed. It's a hands-on service.
Lisa began working as an estate administrator in 1990. She'd often step in by default when one of her clients needed someone to speak with their doctor about medications, checking medical claims for accuracy, and watching over them in the hospital. After undergoing successful brain surgery in 2007 for a rare nerve disorder, trigeminal neuralgia, and Lisa's successful appeal with her own medical insurance carrier to cover her selection of an out-of-network neurosurgeon, Dr. Wesley King in West Los Angeles, the direction of her work and the name of her company took a new, exciting path. Estate administration for the affluent was pushed aside for healthcare and life care advocacy for people from all walks of life. SOUL SHERPA was launched in 2008. For every paying client Lisa accepts, she takes on one pro bono.
I was an estate administrator, but had begun to realize that regardless of the financial well-being of my clients, they were being left more and more vulnerable when it came to someone helping them oversee their continuity of health care. So I shifted my focus at that point, and I love the concept of a Sherpa, which is a guide who, according to Buddhist beliefs, needs to undertake a project with the right intention. So I like that combination of being responsible for a person's well-being as well as making sure I'm doing it for the right reasons.
The company has worked with clients in their homes, offices, hospitals, and long-term care facilities. Lisa says the ability to support clients undergoing such significant life transitions is an honor and a privilege.
Providing emotional support is a wonderful way to just cut to the chase of what's real and what's going on in that person's life. We don't have to cut through any clutter or any obstruction to get to the core of what's going on and the core of who people are. So I'm able to deal with them genuinely from the beginning, and it's a wonderful way to interact with a person.
I was leaving work about 6:30 one evening and had a fall, and the paramedics came, took me to the hospital, and that's when the difficulties started. And Lisa was able to step in for me, help me with the insurance company. Without her, I would not have been able to have collected from them at all. And she really did an advocate's job.
Soul Sherpa is known for its empathy, attention to detail, transparency, and excellence. Given the fact the most rapidly rising cost over the next several decades will be skyrocketing healthcare costs, Lisa feels compelled to advocate for her clients, not only medically, but to also ensure those clients have addressed their legal, financial, and insurance preferences properly. Soul Sherpa has never had a client readmitted to a hospital within 30 days of discharge due to the same condition. That in itself has saved her clients a tremendous amount of money, not to mention anxiety.
I think we need more patient advocacy because unfortunately there's a lot of patients that are in the same boat and they just don't know where to go, what is their best option, and what would be the best benefit. And then they don't know what doctors are covered, what hospitals are covered, what services are covered. There's all kinds of different deductibles, there's all kinds of different co-pays, there's all kinds of different plans, and I think it's really difficult for patients to be able to sort through all of that. So I think we need an explosion of advocacy people to help navigate this system because it is so complex.
And you can see that you've got your annual physical next month.
Soul Sherpa leaves nothing to chance because its services affect the life and well-being of each of its clients. To learn more about Soul Sherpa's services, educational offerings, and plans to launch a foundation, call or visit soulsherpa.net today.